संगच्छध्वं संवदध्वं संगच्छध्वं संवदध्वं संवो मनांसि जानता संवो मनांसि जानता देवाभागं यथा पूर्वे देवाभागं यथा पूर्वे संज्ञानाना उपासते संज्ञानाना उपासते संज्ञानाना उपासते संज्ञानाना उपासते संज्ञानाना उपासते संज्ञानाना उपासते.
Neck movements. Forward and backward neck bending. Caution: avoid this practice in case of severe cervical spondylitis. Start with alert posture Samsthiti. Stand with feet 2-3 inches apart. Keep the hands straight beside the body. Now, keep the hands on the waist. While exhaling, move the head forward slowly and try to touch the chest with the chin. As you inhale, bring the head to the center position. While exhaling, move the head backward comfortably. Bring the head to the center position. This is one round. Repeat for one more round. Right and left neck bending. Caution: do not overstrain during this practice. While exhaling, bend the head slowly to the right and bring the ear as close as possible to the shoulder without raising it. Experience stretching on the left side. As you inhale, bring the head to the center position. While exhaling, bend the head slowly to the left side. Experience stretching on the right side. Inhale and bring the head to the center position. This is one round. Repeat for one more round. Right and left neck twisting. Caution: do not jerk the neck. Keep the head upright. While exhaling, gently turn the head to the right so that the chin is in line with the shoulder. As you inhale, bring the head to the center position. While exhaling, gently turn the head to the left. Feel or experience stretching on the right side. Inhale and bring the head to the center position. This is one round. Repeat for one more round. Neck rotation. Caution: people with neck pain and cervical spondylosis, do this practice carefully. Exhale. Bend the head forward, trying to touch the chest with the chin. Inhale slowly. Rotate the head clockwise in a circular motion. And exhale while coming down. This is one round. Repeat for one more round. Then rotate the head in an anti-clockwise direction. Inhale, go back, exhale, and come down. This is one round. Repeat for one more round. Inhale and bring your head to the center position. Exhale. Bring the arms down and relax. Shoulder movements. Shoulders and arms movement. Caution: frozen shoulder patients should do this practice carefully. Start with alert posture, samsthiti. Stand with feet 2-3 inches apart. Place the hands by the sides. Keep the fingers together, pointing downwards. While inhaling, move both the arms from the sides up above the head, with the palms facing outward. Exhale and bring them down. This is one round. Repeat for one more round. Shoulder rotation. Stand straight. Inhale and raise both the arms up to shoulder level by the sides. Bend the arms at the elbows. Place the fingers on the respective shoulders. Try to touch the elbows in front of the chest, and then rotate both the elbows and shoulders in a circular manner. This is one round. Repeat for one more round. Inhale while raising the arms and exhale as you bring them down. Repeat the same in a reverse manner for 2 times. Inhale while raising the arms and exhale as you bring them down. Now inhale and stretch the elbows by the sides. Exhale, bring the arms down and relax. Trunk twisting. Caution: in case of vertebral disorders, do this practice under guidance. Start from the alert posture. Stand with feet about 1 foot apart. Raise arms to the chest level, facing each other, and keep them parallel. While exhaling, twist the body towards the right side so that the left palm is close to the right shoulder. Come back as you inhale. While exhaling, rotate the trunk and spine towards the left side. Come back with inhalation. This is one round. Repeat for one more round. Slowly bring the arms and feet back together as you exhale. Relax. Knee movement. Caution: in case of arthritis and obesity, do this practice carefully. Start in an alert posture. Then keep the feet 1 foot apart. Inhale. Move the arms up the shoulder level from the front, with palms facing downwards. Exhale. Bend the knees and bring down your body to the half squatting position. In the final position, both the arms and thighs should remain parallel to the ground. Come back as you inhale. This is one round. Repeat for one more round. Come back with inhalation. Slowly return the arms as you exhale and bring the feet together. Relax. Ankle movements. Benefits. The exercise relieves rheumatism of the ankles and strengthens the toes and the feet. Caution: avoid this practice in case of acute conditions of arthritis. Ankle stretch. Stand straight with the feet few inches apart. Place the hands on the waist. Inhale. Lift your right foot up to at 9 inches off the ground. Now, stretch the ankle joint forward and backward. Repeat 2 more times. Bring the right foot down. Now repeat with another foot. Inhale. Lift your left foot up to at 9 inches off the ground. Now stretch the ankle joint forward and backward. Repeat 2 more times. Bring the left foot down. Release the hands and relax. Ankle rotation. Stand straight with the feet few inches apart. Place the hands on the waist. Inhale. Lift your right foot up at 9 inches off the ground. Slowly rotate the right foot clockwise 3 times. Now, repeat the rotation in anti-clockwise 3 times. Bring the right foot down. Now, repeat the same practice with another foot. Inhale. Lift your left foot up at 9 inches off the ground. Slowly, rotate the left foot clockwise 3 times. Now, repeat the rotation anti-clockwise 3 times. Bring the left foot down. Release the hands and relax. Surya Namaskar, Sun Salutation. Surya or Sun is the source of energy to all the living beings on this planet Earth. Surya Namaskar is the set of 7 yogic poses performed in 12 steps in the early morning to refresh and energize the body and mind for the day activity. It is being practiced as part of yoga sadhana or practice over the centuries for healthy living. Benefits: it helps to increase the flexibility, lungs capacity, strength, endurance, and develop a healthy spine. It makes the mind alert and fresh. Caution: avoid during spinal injury. Practice it as per need and capacity. Girls should avoid during the menstrual periods. Starting position: Samasthiti. Stand upright with feet together and arms by the side of the body. Balance the body equally on both feet. Inhale. Raise both the arms up and join the palms together. Exhale. Bring them in front of the chest, as in Namaskara Mudra or prayer position. Hastotana Asana. Inhale. Raise both the arms up, keeping the arms close to the ears. Stretch the body as much as possible and bend the trunk backward without bending the knees. Padahastasana. Exhale. Bend forward from the lowermost part of the spine and base of the buttocks. Place hands on the floor by both sides of the feet. Try to touch the knees with forehead without bending the knees. Ashwasanchalanasana. Inhale. Take the right leg backward as far as possible. Bring the right knee to the floor. Keep the left foot on the floor between the palms. Arch the spine back and look up. Parvatasana. Exhale. Take the left leg back. Lift the hips and tailbone up and lower the head and chest downwards in an inverted V posture. Keep the head between the arms and soles touching the ground. Ashtanga Namaskarasana. Breathe normally. Lower the knees, chest and chin to the floor. In the final position, only the toes, knees, chest, hands and chin should touch the floor simultaneously. The buttocks and abdomen should be raised. Bhujangasana. Inhale. Lower the hips. Raise the head up and push the chest up. Raise the trunk up to the navel with spine arched back. Keep palms on the ground and bend backwards. Parvatasana. Exhale. Lift the hips up and lower the head and chest downward in an inverted V posture. Keep head between the arms and soles on the ground. Ashwa Sanchalanasana. Inhale. Bend the right leg and bring it forward. And keep the right foot on the ground between the arms. Keep the left leg backward with left knee touching the ground. Arch the spine back and look up. Padahastasana. Exhale. Bring the left leg forward beside the right foot. Place both palms beside outer sides of the feet on the ground and head touching the knees. Hastottana Asana. Inhale. Raise arms and torso. Take the arms straight above the head and bend the trunk backwards as much as possible. Namaskara Asana. Exhale. Come to the straight position. Slowly bring the arms down and join the palms in front of the chest as in Namaskara Mudra or prayer position. Bring the arms down and relax. Tadasana. Palm tree posture. Tada means palm tree or mountain. This asana teaches one to attain stability and firmness and forms the base for all the standing asana. Benefits. This asana brings stability in the body, helps to clear up congestion of the spinal nerves and corrects faulty posture. Caution. Avoid lifting the toes in case of acute cardiac problems, varicose veins and vertigo. Alert posture. Stand with feet 2-3 inches apart. Place the hands by the sides. Inhale. Lift the arms to the shoulder level from the front and interlock the fingers. Exhale. Turn the palms outwards. Now inhale and stretch the arms over your head. Raise the heels off the floor and balance on the toes. Maintain the final position for 3 to 5 breaths with body awareness. Bring the heels down. Release the interlock of the fingers. Exhale. Bring the arms down by the sides and come back to the starting position. Relax. Urdhva Hastottana Asana. Upward side bend pose. Urdhva means upward. Hasta means arms and Uttana means stretched up. In this asana, arms are stretched upward. Therefore, the asana is named Urdhva Hastottana Asana. Benefits. It strengthens the trunk, core, upper and lower limb muscles. It enhances the thoracic cavity movement. Cautions. Avoid in case of recent shoulder or neck injury. People with hypertension, vertigo or balance issues should practice with caution. Technique. Stand straight with the feet a few inches apart and arms relaxed alongside the body. Inhale. Lift both arms to shoulder level in front of the body. Interlock the fingers and turn the wrists outward with exhale. Inhale. Raise the interlocked arms above the head, keeping them close to the ears. Exhale. Slowly bend the torso to the right side from the waist. Hold the position for a few seconds with normal breathing. Inhale. Return to the upright position. Exhale. Slowly bend the torso to the left side from the waist. Hold the position for a few seconds with normal breathing. Inhale. Return to the upright position. Exhale. Release the interlocks. Bring the arms down and relax. Gaumukhasana. Cow face pose. Gaumukha consists of two words, Go, meaning cow, and Mukha, meaning face. In this asana, the knees, thighs, and calves together make a form that resembles cow's face. Benefits: it enhances the respiratory health. It is useful in shoulder and neck pain management. Precaution: avoid this asana in case of joint injuries, acute pain in shoulders, and piles problem. Sit with both legs extended forward. Place the hands beside the body and fingers pointing forward. Bend the right leg and bring the right heel beside the left buttock. Now, bend the left leg and place the left heel beside the right buttock. Keep the spine straight and sit evenly on both buttocks. Raise the right arm up. Bend the elbow and bring the right hand down behind the upper back. Simultaneously, bring the left arm behind the back and try to clasp the fingers of both hands. Keep the head and neck aligned with the spine. Breathe normally and hold the posture few seconds or as comfortable. Gently release the hands and stretch both legs forward into Dandasana. Repeat the same steps on the other side by switching leg and arm positions. Breathe normally and hold the posture few seconds or as comfortable. Gently release the hands and stretch both legs forward into Shithila Dandasana and relax. Ardha Ushtrasana, the half camel posture. Ushtra means camel. The final version of this asana resembles the hump of a camel. In this version, only the first stage, that is half of the asana, can be practiced. Benefits: it helps to strengthen back and neck muscles, relieves constipation and back pain, increases blood circulation to the head and cardiac region. Very useful practice for cardiac patient, but needs to practice with cautions. Caution: avoid doing this asana in case of hernia and abdominal injuries, arthritis, and vertigo. Start with long sitting posture. Sit straight with the legs stretched out in the front and palms resting on the ground with fingers pointing forward. This is Dandasana. Fold the right leg at the knee and place the foot under the right buttock. Similarly, fold the left leg and place the left foot under the left buttock. Place the hands on the respective knees. Stand on your knees. Place the hands on your back with fingers pointing downwards. Keep the elbows parallel. Inhale, bend the head back and stretch the neck. Exhale, bend the trunk backwards as much as possible. Keep the thigh perpendicular to the ground. Maintain the final position for 3 to 5 breaths with body awareness. Inhale, come back to the kneeling position. Exhale, sit in Vajrasana. Bend a little towards the right side to take out your left leg and extend it. Similarly, extend your right leg and return to the starting position. Relax. Uttana Mandukasana, stretched up frog posture. Uttana means upright and Manduka means frog. The final position of Uttana Mandukasana would resemble an upright frog, hence the name. Benefits. This asana is helpful in backache and cervical pain. It helps in improving the diaphragmatic movements and helps to improve lung capacity. Caution. Person with severe knee joint pain should avoid this practice. Start with a long sitting posture. Sit straight with the legs stretched out in the front, palms resting on the ground and fingers pointing forward. This is Dandasana. Fold the right leg at the knee and place the foot under the right buttock. Similarly, fold the left leg and place the left foot under the left buttock. Place the hands on respective knees. Spread the knees wide apart. Inhale. Slowly raise the arms upward from the front. Exhale. Fold them from the elbow and place the palms on alternate shoulder blades. Right palm on the left shoulder blade and left palm on right shoulder blade. Maintain the final position for 3 to 5 breaths with body awareness. Now inhale and raise the arms up. Exhale. Bring the arms down and close the knees together. Bend a little towards the right side to take the left leg out and extend it. Similarly, extend the right leg and return to the starting position. Relax. Vakrasana, the spinal twist posture. Vakra means twisted. In this asana, the spine is twisted, which has a rejuvenating effect on its functioning. Benefits. Increases flexibility of the spine. Helps to overcome constipation, dyspepsia. Stimulates pancreas and helps in the management of diabetes. Caution. Please avoid this posture in case of severe back pain, vertebral and disc disorders, after abdominal surgery and during menstruation. Start with long sitting posture. Sit with the back straight and legs stretched out in front. Bend the right leg and place the right foot beside the left knee. Place the right palm beside the body. Bring the left arm around the right knee and place the palm beside the right foot. Inhale. Stretch the back. Exhale. Turn the body and head to the right. Maintain the final position for 3 to 5 breaths with body awareness. Inhale and come back. We will now repeat the same on the left side. Bend the left leg and place the left foot beside the right knee. Place the left palm beside the body. Bring the right arm around the left knee and place the palm beside the left foot. Inhale, stretch the back. Exhale, twist the head and body to the left. Maintain the final position for 3 to 5 breaths with body awareness. Inhale, come back to the starting position. Relax. Makarasana, the crocodile posture. In Sanskrit, Makara means crocodile. In this asana, the body would resemble crocodile, hence this name. Benefits. This asana promotes relaxation of the whole body. It helps in the recovery of back problems. Caution. Avoid this practice in case of pregnancy and frozen shoulders. This asana is practiced for relaxation in all prone postures. Start in Vajrasana. Slowly lie down on the stomach with feet together and toes pointing outwards. Place the chin on the ground. Stretch your arms forward. Open the feet apart with toes pointing sideways. Bend your elbows and rest the chin on the hands. Lift the head up and place your cheek on the hands. Close the eyes and allow the entire body to relax. Maintain the funnel position for 3 to 5 breaths with body awareness. Remain aware of the body and breathing. Bhujangasana, the cobra posture. Bhujang means snake or cobra. In this asana, the body is raised like the hood of a snake. Benefits: this asana relieves stress and constipation and reduces abdominal fat. It helps to relieve backache and bronchial problems. Caution: those who have undergone abdominal surgery should avoid this asana for 2-3 months. Those who are suffering from hernia or ulcers should not practice this asana. Start with Makarasana. Now join the legs. Stretch your arms forward and rest the chin on the ground. Now place your palms beside the chest and elbows close to the body. Inhale slowly and lift the head and chest up to the navel region with the help of the spinal muscles. Keep the elbows parallel. Maintain the funnel position for 3 to 5 breaths with body awareness. Exhale. Bring the head down and rest your chin on the ground. Relax in Makarasana. Pavana Muktasana, the wind-releasing posture. Pavana means wind and Mukta means to release or to make free. As the name suggests, this asana is useful in removing wind or flatulence from the stomach and the intestine. Benefits: it removes constipation, gives relief from flatulence, decreases the bloating sensation in the abdomen, and aids digestion. It generates deep internal pressure and improves stretching of the highly complicated network of muscles, ligaments, and tendons in the pelvic and waist regions. It tones up the back muscles and spinal nerves. Caution: avoid this practice in case of abdominal injuries, hernia, sciatica, severe back pain, and during pregnancy. Lie comfortably on the ground with legs stretched out, hands placed by the sides and palms facing downwards. Bend both the knees. Exhale. Bring the knees towards the chest. Inhale. Interlock the fingers and clasp the shin below knees. Exhale. Raise the head up until the chin or nose touches the knees. Maintain the final position for 3 to 5 breaths with body awareness. Inhale. Bring the head back to the ground. Exhale. Release the legs back to the floor. Lie down in supine position. Relax. Matsya Asana, fish pose. In yogic tradition, Matsya Asana is believed to be the pose that allows one to float like a fish in water. Benefits: enhances breathing and lung function, stretches spine, chest and neck, strengthens upper back and core, may relieve stress and tension. Caution: avoid with high or low BP or migraines. Be careful with neck, back issues. Not for severe asthma or recent surgery. Lie flat on the back with legs and feet together in a straight line. Place the hands and arms close to the body with the palms facing down. Slowly lift your legs and fold the knees. Place the right foot on the left thigh and the left foot on the right thigh. Ensure the knees touch the ground. Place the palms on the floor beside the head, with the fingers pointing towards the shoulders. Lift the chest slightly. Take the head back and lower the crown of the head to the floor with the support of the palms. Slowly release the hands. Hold the big toes and rest the elbows on the floor. Close the eyes and breathe slowly and deeply for a few seconds. Return to the starting position. Place the palms on the floor beside the head. Exhale slowly and lower the torso and head to the floor. Place your arms beside your body. Slowly straighten your legs. Now split legs apart and palm facing upwards and relax in Shavasana. Shavasana, the dead body posture. Shava means dead body. The final position in this asana would resemble a corpse or dead body. Sthiti, Shavasana, supine lying posture. Benefits. This asana helps to relieve all kind of tension and gives rest to both body and mind. The mind, which is constantly attracted to the outer world, takes a U-turn and moves inwards, thus gradually getting absorbed. As the mind turns quiet and absorbed, the practitioner remains undisturbed by the external environment. It is found beneficial in the management of stress and its consequences. Lie down on the ground. Open the feet apart, with toes pointing sideways and palms facing upwards. Close your eyes. Consciously relax the whole body. Become aware of the natural flow of breath. It will tend to become slow. Remain in the position until you feel refreshed and relaxed. When ready to release, slowly stretch your arm over the head and join the feet. Then turn by the side, either right or left, and come back to the sitting position with the support of the hands. Kapalabhati. Kapala means skull. Bhati means to shine or to cleanse. It is a cleansing practice which helps to clean the frontal sinuses and upper respiratory tract. Benefits. This practice purifies the frontal air sinuses, helps to overcome cough disorders. It is useful in treating cold, rhinitis, sinusitis, asthma, and bronchial infections. It rejuvenates the whole body and keeps the face glowing and vibrant. It strengthens the nervous system and tones up the digestive organs. A word of caution. Avoid this practice in case of cardiac conditions, giddiness, high blood pressure, vertigo, chronic bleeding in the nose, epilepsy, migraine, stroke, hernia, gastric ulcer, pregnancy, and during menstrual cycle. Sit in any comfortable position. Keep the spine and head straight with eyes closed. Place the hands on the knees in Jnana Mudra. Inhale deeply through both the nostrils till you start to experience fullness in the pelvic area and expansion in the chest. Expel the breath with forceful contractions of the lower abdominal muscles and let the inhalation be passive. Let us begin the first round of Kapalabhati with 20 strokes. Exhale deeply and relax. This is 1 round of Kapalabhati. Repeat 2 more rounds with 20 strokes each. Abdominal breathing. Diaphragmatic breathing. A deep breathing technique where the diaphragm expands downward, allowing the abdomen to rise, enabling full lung expansion and relaxed breathing. Benefits: promotes calmness by reducing psychological stress responses, improves lung efficiency and supports respiratory health. Caution: may cause discomfort in individuals with recent abdominal surgery or hernia. Should be avoided immediately after meals to prevent internal pressure. Keep back and neck straight. Place both the palms in Jnana Mudra on respective knees. Now place right hand on the abdomen. Complete exhale through the nostrils. Inhale for 6 seconds. Abdomen will move outward. Exhale for 6 seconds. Abdomen will move inward. Repeat for few more rounds. Inhale. Exhale. 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 Relax and bring the right hand back. Thoracic breathing. Chest breathing. A breathing pattern that expands the rib cage using intercostal muscles, supporting moderate oxygen demand and enhancing postural awareness. Benefits: useful during physical activity to increase oxygen supply, strengthens chest muscles and supports better breathing mechanics. Caution: habitual use at rest may lead to shallow breathing and reduced relaxation. Can cause upper body tension if practiced excessively without awareness. Keep the spine erect. Place both palms on the chest. Observe the breath concentrate on the thoracic region. Inhale for 6 seconds. Feel expansion of thoracic region. Exhale for 6 seconds. Relax the thoracic region. Repeat for few more rounds. Inhale. Exhale. 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 Relax and bring the hands back. Clavicular breathing. Upper chest breathing. A breathing practice that uses the upper chest and collarbones, allowing additional air intake when deeper areas of the lungs are underutilized. Benefits: supports breathing in states of high exertion or respiratory challenge. Complements full yogic breathing by engaging the upper lung region. Caution: inefficient when used habitually, leading to fatigue and shallow breath. May be associated with anxiety-related breathing patterns if unregulated. Place both the palms on the opposite shoulder blades. Inhale for 6 seconds and expand the upper region of lungs around the collarbone. Exhale slowly for 6 seconds. Relax the neck region. Repeat for 4 more times. Inhale. Exhale. 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 Relax and bring the hands back. Pranayama. Nadi Shodhana or Anulom Vilom Pranayama. Alternate nostril breathing. The main characteristic feature of this pranayama is alternate breathing through the left and right nostrils without or with retention of breath, that is kumbhaka. Benefits. The main purpose of this pranayama is to purify the principal channels of carrying energy, called nadis. Hence, nourishes the whole body, induces tranquility and helps to improve concentration, increases vitality and lowers the level of stress and anxiety. It elevates cough disorders. Start with sitting in any comfortable posture. Breath should be slow, steady and controlled. Keep spine and the head straight with the eyes closed. Relax the body with few deep breaths. Keep the left palm on the left knee in Jnana Mudra and the right hand should be in Pranayama Mudra with the middle and the index fingers folded like this. Close the right nostril with the right thumb and exhale completely. Now inhale through the left nostril. Recognize the touch of air moving through your body as prana. Then close the left nostril with the ring and little finger of the right hand and exhale through the right nostril. Now inhale through the right nostril. Close the right nostril with the thumb and exhale through the left nostril. This is one round of Nadi Shodhan Pranayama. Repeat it for 4 more rounds. Bhramari Pranayama. Bhramari is derived from Bhramara, which means black bee. During the practice of this pranayama, the sound produced resembles the buzzing of a black bee, hence the name. Benefits. It relieves stress and helps in alleviating anxiety, anger and hyperactivity. It creates a soothing effect on the nervous system and mind. It is a great tranquilizer and found good in the management of stress-related disorders. It is a useful preparatory pranayama for concentration and meditation. Caution. Please avoid this practice in case of nose and ear infections. Sit in any comfortable posture. Keep the spine and head straight with the eyes closed. Place the hands on the knees in Jnana Mudra and inhale deeply through the nose. Exhale slowly, making a deep humming sound. Repeat 1 more round. Practice the Bhramari Pranayama with Sanmukhi Mudra. Using your index fingers, gently close your eyes. Then place the middle finger beside your nose without fully covering it. Place your ring finger on your upper lip and your pinky finger on your lower lip. Finally, rest your thumbs on your ears as demonstrated in the video. Inhale deeply through the nose. Exhale slowly, making a deep humming sound. Repeat one more round. Ujjayi Pranayama, victorious breath. Ujjayi means victorious. Ujji is the root, which means to conquer or acquire by conquest. In English, Ujjayi is known as the psychic breath because of its effect on the mind. Benefits: this practice soothes the nervous system and calms the mind. Caution: people who are too introverted by nature should not perform this practice. Sit in any meditative posture, Sukhasana or Padmasana. Rest your hands on your knees in Jnana Mudra with your eyes closed. Keep your spine and head straight. While inhaling, gently contract the glottis so that a soft snoring sound like the breathing of a sleeping baby is produced in the throat. Then exhale slowly through the both nostril. This is one round. Repeat for a few more rounds. Sitakari Pranayama, hissing breath. Sitakari Pranayama. From Sanskrit, Sita meaning to hiss and Kari meaning doing. Hence the practice of producing a gentle hissing breath. Benefits: this pranayama has a cooling effect on the body and mind. It is beneficial for persons suffering from high blood pressure. It satisfies thirst and appeases hunger. Caution: in case of low blood pressure, asthma, cold and cough or other respiratory problems, this pranayama should be avoided. Sit in any meditative posture, Sukhasana or Padmasana. Rest your hands on your knees in Jnana Mudra with your eyes closed. Keep your spine and head straight. Hold the teeth lightly clenched together. Separate the lips, exposing the teeth, keeping the tongue flat. Breathe in slowly and deeply through the teeth. At the end of the inhalation, close the mouth. Breathe out slowly through the nose in a controlled manner. This is one round. Repeat for a few more rounds. Dhyana. Sit in any comfortable position. Place the hands on the knees. Close your eyes. Now adopt Dhyana Mudra and sit in a slightly upturned face. You need not concentrate. Just maintain a mild focus between the eyebrows and be conscious of your breath. Let them flow freely. Just observe the flow. If possible, let the thoughts dissolve.
सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् मा कश्चित् दुःखभाग् भवेत्। ॐ शान्ति शान्ति।